Welcome to The Controversial Truth, where we bring you content on health and wealth that no one would ever tell you until now. I'm your host, Dr. Victoria Munoz, and I'm pleased to present a very special guest today. Dr. Ana Laura graduated from Southwest College of Naturopathic Medicine, now Sonoran University, in 2017. She specializes in the treatment of chronic disease and runs a very successful private practice in Phoenix, Arizona. She spends her spare time continually educating herself and bringing the best medicine to her patients. She also spends time working out in a kickboxing gym, hiking Arizona trails, and spending time with family and friends. She is not only a brilliant doctor, but a colleague and a good friend. Dr. Ana Laura, it is an honor to have you here today. We have so much to cover.
Yes, a lot.
So I'd like to start out by talking about what sets naturopathic medicine apart from the conventional medical arena. Like, for example, what is naturopathic medicine? Let's just start there.
Absolutely. I think a lot of people are used to the conventional medical system of what that experience is like. But when hasn't worked for them, they've gone to doctors and specialists and they haven't gotten any improvements. They still feel sick. People start to seek out of that model, and they start to look for different ways that they can possibly heal. So when people they look for a naturopathic doctor, they're looking for a whole different approach. And that's what we're about. We are completely different than a conventional medical doctor. So one of the things that sets us apart is that we are looking for the root cause of disease. We're looking at all the areas of a person's life, right? That's how we were trained to do. We look at their eating habits. We look at their sleep habits. We look at, are they exercising or not? Do they sit a lot? What is their stress? Stress plays a huge component in a person's health. So what are their stressors like? Are they drinking water? Are they consuming a lot of sugar? What's their lifestyle like? And we do lifestyle medicine. That's what we do.
Yeah.
Mm-hmm. So we need to take a look at all of that. And in order to do that, we really focus on developing relationships with our patients. They're not just a number.
Right.
They're not just a diagnosis. I know a lot of people ask me, well, Dr. Laura, what do you do? What kind of conditions do you see? Well, I don't treat conditions. I don't treat symptoms. I work with people. Mm-hmm. And in order to do so, we need to get to know those individuals that we're going to work for, that we're going to be helping. And so you need to develop a relationship on trust, on respect, and people need to feel comfortable telling us their life, sharing their life. So when they come see a naturopathic doctor, a lot of people are not used to, spending an hour with the patient, not even 30 minutes with their doctor, right? Yeah. They're not used to spending 30 minutes with their doctor. It's usually 5 minutes, and if they're lucky, 5 minutes.
And a prescription, and they're out the door.
Here's your prescription. Yeah. We'll see you in a month.
Yeah.
And I don't blame the doctors necessarily, the medical doctors. It's the system. That's the way that system is set up. It's to be quick. They got to see 20, 30 plus people in a day in order to work in that insurance model. Right. Otherwise, they're not going to be in business. Mm-hmm. And so for us, we slow that process down. We're looking at the quality of the relationship between the doctor and the patient. Mm-hmm. So it's a whole different experience. And this is why I tell people, you cannot compare what a naturopathic doctor does and a medical doctor, because we're on completely different paradigms. Our approach is different. Our relationship style is different. The modalities that we use to treat people, completely different.
Yeah, tell me a little bit about that, how it's different. Like, I know I've talked in previous episode how MD medical students, they take about 18 credit hours a term. They have summers off. They only have didactics for the first 2 years, and then the last 2 years are just clinicals, and they're done. And naturopathic medical students have a tremendous load in school. So tell us a little bit about that.
About the experience as a medical student?
Yeah, like what they experience in terms of, like, you know, we're taking 32 credit hours a term for the full 4 years, and clinicals, and the load that's involved, and the different clinical exams that we have to take each year to pass for the year to move on.
So I think what a lot of people may not know about naturopathic doctors is that we do all the hardcore sciences too. Yeah. All the physiology, anatomy, physiology, the microbiology, the biochemistry, gastroenterology. We do all of those. We have to, pharmacology. You know, a lot of people don't know that we study pharmacology, and they think, why, if you're using natural medicine? Well, in the state of Arizona, we can't prescribe medications. However, we also need to understand, right, the contraindications of if someone's on a certain medication and we're going to give them an herbal medicine, or we're going to make other changes, we need to know what the contraindications. We need to make sure it's safe for them. So we still need to understand the pharmacology. So yeah, we are medical doctors. On top of all the medical sciences, you know, people don't even know that we learned how to do minor surgery. Mm-hmm. You know, during COVID, I was like a little, urgent care, doing minor surgery on people who didn't want to go to the hospital. And so they were happy to know that, hey, their naturopathic doctor is trained and can perform that minor surgery, whether it's to remove a cyst, or they got cut and I need to do stitches. Like, that's what we're trained to do. Right. We are medical doctors. Mm-hmm. On top of that, you know, from the beginning, we are trained to integrate all the natural modalities, right? We learn all the nutrition. I mean, we have a whole year of nutrition, which most doctors don't. I think they have like a couple hours maybe of nutrition. They don't have any. Or any. Yeah. Yeah, so we have a whole year of nutrition. And it's not just nutrition based on like what a registered dietitian does. Like, we learn how to use food as medicine, mm-hmm. and create, right, certain diets for certain medical conditions. So it's clinical nutrition. How do we apply that? We're learning all the botanical medicine, all the traditional Chinese medicine, acupuncture, the Chinese herbs, right? We're learning physical medicine. We're learning homeopathy. We're learning mind-body medicine. So if you really took all the different tools, all the different areas of natural medicines that we learn, it's like another 4 or 5 degrees on top of a medical degree. Mm-hmm. So it's ludicrous, you know, when people ask me, well, what is it? How was a naturopathic doctor trained? And I explain all these areas that we learn. They realize, wow, that's a lot, and it's really hard to spend that kind of time in 4 years. And mind you, the last 2 years of our training, we are seeing patients in clinic. Yeah. So we're getting exposure in a clinical setting, applying these concepts, right, to our patients, to learn how to integrate in from the beginning, and assessing labs and imaging, and, you know, doing all the diagnostic work still, because that we are medical doctors. But on top of that, it's the natural side that we start with. I don't think that natural medicine should be the alternative medicine. I think that should be the beginning stages of helping people. Mm-hmm. We start with the least invasive and we work our way up from there. Obviously, if someone's leg, you know, if they're cut open and bleeding, yeah, go to the ER. Right. Don't come see a naturopath. Yeah. I mean, there's a time and place for everyone. Yeah. But for most people with chronic, you know, conditions, there needs to be an integration of nutrition and making sure they're sleeping, making sure there's a lot of benefits of exercise. It's not just to be thin and look great. I mean, that's a benefit, right? Sure. Yeah. But there's a lot of medical benefits for a person to be moving their body. I always say the Creator created our bodies to move. Otherwise, He wouldn't give us skeletal muscle and bones and all of that structure. Yeah. Our bodies are meant to move. Mm-hmm. Yeah. Yeah.
And many of you don't know what metabolic syndrome is, but it's basically overweight, high blood pressure, diabetes, on and on and on. And metabolic syndrome is a precursor, for lack of a better term, to cancers.
It really
Yeah.
is.
People think that
Yeah.
cancer is a genetic disease. It's not. It's a lifestyle disease.
It really is. When I screen my patients, I look at their insulin numbers and their C-peptide, whether there's a history of it or not. And it is amazing to see how many people who are not diabetic, they have, high levels of insulin. And so that creates an inflammatory process, and that insulin, high insulin, I mean, you're fasting, right? And you're doing this test.
Uh-huh.
It should not be elevated.
Right.
You haven't ate.
Right.
So why is your body pumping out so much insulin? That's
Mm-hmm.
a problem. And this is a precursor to developing cancer. Just recently I had a 21-year-old female, really high levels of insulin. I think the range is under 24, 25 fasting. Hers was 55
Mm-hmm.
and in a fasting state. And she came in to see me because she has these cysts that she noted on her breast. We did ultrasound, we did imaging. It's benign. I gave her recommendations, diet and what we're going to do to lower the insulin and so forth. I mean, this is very standard American diet, just a lot of sugar, a lot of processed foods. She did none of what I told her to do. I don't know why. I screen my patients
Takes
to make sure
work.
it takes work. And she's 21, she's in college, she's around friends. It's a social thing for them. I get it. So then she calls, a little hysterical because she noted that she has more of those lumps in her breast, and not just on one side, but now it's the other. And I asked her, well, did you change your diet? Did you do did you follow the regimen? And she was honest. She said no. And I said, well, what do you expect? You're gonna get more of this, and it's benign now, but this can turn into a cancer. So let's get on it. Let's make the changes. We've already discussed this. And that really scared her, and so she started, working on the diet, taking the supplements, the herbal stuff, everything, moving, starting to exercise more, to give her body time to reverse this, because it can be reversed. Whatever you did to get there, you can undo to reverse it.
Mm-hmm. That's what a lot of people don't realize, and that's what the convention is not going to tell people.
Mm-hmm.
They will prescribe you all these medications for the symptoms you're having, but they never address the root cause.
They never address the root cause. The other thing that naturopathic doctors that we really aim for, I would say at least the majority of us, is that we don't want to see you every month.
No.
We don't want to see you every month.
No.
I mean, I love my patients. I really do. But it makes me feel good to see them improve and reverse disease. And then guess what? They just come back when they need to see me.
Right.
If they're acutely ill and they can't get over something, that they'll come see me. And they'll refer other people because they got results,
Absolutely.
And that's how I stay in business. That's how we stay in business.
Yeah, right.
Because we actually help people get better,
Mm-hmm.
and then they spread the good word to everyone else, and that's it. I don't want to see them every month. I mean, that's the most discouraging patient for me, is the person that is coming every month and they're not doing their part. So they're seeing some changes, but I know they're not seeing the optimal changes they could possibly see, because they're not being compliant even halfway there.
Right.
So it's kind of discouraging to me. It's like, I can't care more about your health than you.
Right.
That's an unhealthy relationship. If I care more about my patient's health than they do about their own health, it's not going to work.
We got to meet halfway.
We got to meet halfway.
Yeah.
I'm willing
if the doctor's
to meet
doing
you.
all the work, there's no 80-20
No.
in this kind of
So
medicine.
here's what I tell patients before I decide to, start working with them. I tell them, the way I work with patients is that I want them to be in the driver's seat when it comes to taking care of themselves or their health. You have to participate. This is your body. This is your body you're in. It's not my body.
Right.
And I want you to be in the driver's seat, and I'm going to provide you the roadmap. All you got to do is make sure your car is fueled. It's in running condition. Tires have air.
Change the oil once in a while.
Change the oil. Come on. I mean,
rotate the tires.
rotate the tires. Do the maintenance stuff on there. And I'm going to provide you the roadmap, and you just have to follow the instructions. And if you lose your way in that roadmap, in that plan, that's fine. That I'm here to guide you back on there. But it takes a partnership, and that is what sets us apart from conventional medicine. They don't do that.
Yeah.
They don't care to educate people.
Absolutely not.
They don't, not at all.
Mm-mm.
You know,
That's
the
a threat.
contrary.
That's a threat to their profits.
It is.
Yeah.
It's the contrary. They don't think that people are capable of learning and understanding. They want you to be dependent on them.
Right. So let's talk a little bit about that. What are we taught as we go through the education system and by the government and the media? What are we taught as we grow up, and what's required to change our thinking?
Yeah, it's a great question. I think from your generation to mine to what it's now, completely different. You know, what's being kind of indoctrinated right now is very different. You know, where right now young people are being taught in a way to be dependent and almost like a victim-like mentality, so that you can depend on someone else. Like, well, I'm not being given enough information. We saw this in medical school too, where the younger generations, they were dependent on the teachers giving them exactly what they needed to know. And it's called reading your textbooks, you know, doing the research, doing your work. You can ask questions, but it's almost like you feel privileged, like you should give me the information without me seeking for the answers. And there's something very important in when you become a seeker in life. You know, you're the kind of person that's searching for answers. You will find the answer, versus the person who is waiting for the answer to arrive. Good luck, honey. Good luck. Opportunities don't come knocking at your door.
No.
You have to go out and seek it, and you have to look for those opportunities and knock on doors. And the same thing comes with anything in our life: health, finances, starting a business, career, or anything.
Right.
We got to go out and look for the information. So the mindset is really, really key. It's really important, is taking yourself out of that victim-like mentality. Nobody owes you anything.
Right.
Nobody owes you nothing.
Not even your doctor.
Not your doctor. It's true though. Not your doctor, not the government, not your teachers.
Yeah.
Nobody owes you anything. And if you can just feel like, okay, nobody owes me anything, now I'm the one in that seat that has to make the decision, make the call. What do I want? What do I want for myself, for my life, the direction I'm heading? And then you start seeking the answers. Now you're going to find people that are willing to help you and will collaborate.
But that's when you put that focus and intention out there, the right people, the right circumstances.
People, absolutely. You attract that. You got to be very intentional. That's the other thing with mindset. You have to be very intentional and be very careful about what you're thinking about, what you're saying, about what the things that you want in life, because you will manifest those things, whether it's good or bad. You're going to make it happen.
Right.
You know, I mean, I teach my kids that, you know, my oldest has this great ability to manifest what she likes. Since the time she was a baby, I noticed that in her. And she did good at manifesting the things that she wanted. Everything she wanted, she would accomplish it. But something happened around the age of 9 and 10 that fear started to set in. And so then I was mindful of her behavior, how she was when she was afraid, that she would manifest those things. And so I would tell her, hey, baby girl, you got to be careful what you're thinking about, how you're feeling about it. You can't fester on that thought and idea too long, because that fear you have, you're going to make it happen. Just the same way you've been able to manifest these other things, you know, and they happen, you're going to make these things happen. And I constantly had to tell her, watch your thoughts, watch your feelings, watch your thoughts, watch your feelings, until she caught on and said, you're right. If I think about this too much, it becomes true, good or bad. So imagine if we have someone like that in our life that's speaking to us that way. Hey, Dr. Munoz, be careful what you're thinking, because you're going to make it happen, good or bad, right? And we need those people in our life. Friends or business partnerships or coaches. You know, why not invest into these sort resources to help change the way our mind works? And that's what naturopathic doctors do. So you're not just getting a doctor, you're getting an educator, someone who's going to help you in the healing process, you're going to get an advocate. But in essence, we are coaches to our patients, because I find myself, I'm sure you find yourself doing the same thing too, where we are coaching our patients on mindset. If, for example, if I diagnose someone with a condition, whether it's autoimmune cancer, so I'm the one sharing the diagnosis with them for the first time, I always prepare them and tell them, hey, this is just information. I don't want you to get attached or marry the diagnosis.
Right. Yeah, absolutely.
It's not for you to take it on as this is me now. It's not you. It's just something you have. It's just information. But here we have some tools. We have some steps on what we're going to do. We have a plan of action, right, of what we're going to do to treat this and to assess it again to see the progression of this. And I always say the progression, not to see if it works.
Right.
We're not going to see if it works. It's going to work. It's going to work.
It's going to work.
And I know it's going to work because I've seen it work. We've
Right.
seen these things work. We know it works. Otherwise, why would we tell them to do it?
Exactly.
And so it's little things like that it matters how we share information to people. You know how many patients have told me how traumatizing their experiences with the medical doctor because of how they shared and conveyed information to them. It was demoralizing to them. It robbed them of hope. We give hope to our patients. We're on the opposite end. And so you working with someone working with a naturopathic doctor, you're getting the best of the best. You really are.
There's different ways of giving a message, right? I mean, like let's say patient has a diagnosis of cancer. You can either instill doom and gloom, or you can say, hey, but we have a solution to this problem.
Absolutely. And I am in that role where sometimes I am diagnosing and saying, hey, there's a thyroid cancer. Here's my approach to this.
Yeah.
And here's what I recommend. And I recommend we start now and we go through the diet and the other therapeutics that I use for oncology. And they're on board with it.
Mm-hmm.
It's that, or you go see an oncologist. And I always refer them to an oncologist. Whether they decide to follow through, that's on them.
Yeah.
That's their choice. But most people, once again, they come see a naturopathic doctor because they want a different approach.
Mm-hmm.
And so they follow the yellow brick road, right?
Yeah.
They follow the steps, they show up for the treatments, and guess what? When we do imaging, we do lab work, things are improving. Great. Let's keep moving forward. I'll even go a step further and share with them, don't go telling everyone you have cancer.
Yeah.
Don't go telling everyone your medical history. 2020 made it very demoralizing for people that they felt they had the need to share their medical history or their decisions on medical treatment. And that is a private experience, and you don't have to share your medical history with just anyone.
Right.
No one has a right to tell you, we're going to go there. No one has a right to ask you, did you get your COVID vaccine?
Absolutely.
You don't ask that. If you're a medical doctor and you're asking for certain reasons, I ask that question because I want to know what labs do I need to be screening this person for to help them with preventative illness in the future.
Mm-hmm.
That's my goal. It's not to judge them. It's not to make them feel bad for their choices. Not at all. That was your choice, and I'm going to respect that. However, my role is to keep you healthy and alive. How can I better guide you in your healthcare? And we saw this a lot. A lot of people making each other feel bad for their choices of
doesn't
healthcare.
belong on social media.
Yeah, I mean, nobody, I don't bash anyone for eating their cheeseburger and fries and then having some ice cream and just sitting all day. I don't. Even when people share that with me, I listen to them. I try to understand why are they making these decisions. Mm-hmm. And I'll tell you, there's always, stress involved in that picture, and there's mental health involved in that picture, trauma. And someone with a lot of trauma is going to, usually, not all the time, but will make poor decisions when it comes to their health. They're trying to, numb and sedate and feel better through food. We talk about addiction and many other sense of the word of addiction, but we never really look at and talk about how the number one source that's really abused is food.
Yeah, and people don't realize how addictive food is and how it can actually poison us.
Absolutely.
I talk about that a lot. How even buying pharmaceuticals and supplements off the shelf can work against your health.
Absolutely.
Yeah.
Oh man, I've seen people really put themselves in a bad, picture. by taking, supplementing themselves with what they thought was okay, and then they end up having, so many issues.
Because they're on Google saying, "Oh, I must have this. I must need vitamin C, or I must need thiamine, or it gets crazy."
Right, it really does.
My joint hurts. I'm going to go get some glucosamine. Well, the stuff you get off the shelf doesn't even have what it says in it most of the time.
Yeah.
So
the quality's not there.
Right.
The quality of the supplements are not there usually. And that's another reason to work with a naturopathic doctor, is that we are trained in understanding what's safe, what to use for what conditions, how much, right? How frequent, how long to use it for, what tests, what things do we need to screen for before we recommend that. And then the quality of the products that we use, it's not what you get at GNC or other, stores, it's just not the same. So that's why when people come see us, they feel better off of the things we've given them. It's a quality product, and it makes a difference. It really does. Yeah.
That's where we get results.
That's why we get results. And people will ask me, they'll bring in all their supplements, and they're all, not good quality ones. They're cheap.
I don't even want to look at this.
Yeah, and I'll tell you, I don't know how beneficial this is for you. I know what these products will do. I know they work. I know how they work. I don't know if this is actually doing anything for you. Oftentimes I have them stop some of those things and then have them just stay on the priority, and they'll see a difference on that, and that's where the guidance comes in. It's not just as easy as, let's just get some vitamins off this, online somewhere at the store and treat yourself. The one thing I will tell people that you can do at home without having to see a doctor is just eat right and move your body and sleep well and drink water, like the
do
basics.
What we were meant to do, right?
Yeah. Our ancestors, 100 years ago, they didn't need to be told, to move their body. My parents grew up without having a vehicle in their town. They didn't have cars. They walked everywhere. So my mom had 9 kids, and they came to this country. Me and my younger brother were born here, but when she had 7 kids, in her country, she didn't look like she had 7 kids. She was a thin woman, because she walked everywhere. Fit. She was fit, and they had no
eating foods that she recognized.
Right. They grew their foods.
You read the label. Okay, what's in this box?
They had no processed foods. That was the thing. The town they were in, everything they grew, they didn't have any processed foods at all. That was her lifestyle, her generation. So then she comes to a country where there's food on every corner.
Yeah.
Well, we once saw that
for lack of
better terms, most immigrants, when they move to this country, will develop chronic disease within the first 5 years of living here.
Yeah.
That has a lot to say about what is our country doing.
They've done a lot of studies on that.
Yeah.
Like, Asians that, come here, for example, they're eating fish and rice, and then they start eating McDonald's, and next thing you know, they have diabetes and hypertension and cancers. Yeah.
Yeah.
And it's estimated that 1 out of every 3 women will get cancer, and 1 out of every 2 men will get cancer. But why is this? Why are we seeing cancer now? We didn't see it before. It's not our genes that are dictating this.
No, it's our environment. From all the toxins in the air, the toxins in the water, in our food. We are being poisoned by our environment. The high levels of stress. I mean, it's crazy. Young kids are stressed. So I know several people who work at Phoenix Children's Hospital, and there's one nurse. She focuses on screening the children for mental health. And in the last 3 years, because of the events that have happened in the world, they've seen more and more children with depression, anxiety, and suicidal ideation. I remember her telling me there was a 6-year-old who attempted suicide. 6 years old. I have a 5-year-old.
Unheard of.
She's playing outside and getting dirty and coloring and playing, being a kid. Like, what's going on in the lives of these children that makes them feel so terrible that they want to end their life? We need to wake up.
Yeah.
We need to really wake up, not just for ourselves, but for the future. For those children. They don't have to be my children to care. Like, we don't need to have children to care about children.
Right.
We need to worry about what environments they're growing up in. And I screen. I see pediatrics so I see teenagers and young 20-year-olds. I check their hormones, and they're not optimal for someone that age. I see 40-year-olds with better hormones than 20-year-olds.
Yeah.
That's a problem.
That is.
You know, and so those people are not going to be able to conceive or even have a healthy life.
Mm-hmm.
By the time they are 30 and 40, they are debilitated. That's our future. We're worried about right now about getting people to work, employees to fill in certain roles in society. Yeah, we're not going to have that because these young people are, you know, once again, it's the foods that they're eating.
Yeah.
Here's the thing. A lot of them are not even eating. They don't have breakfast. They don't have lunch because the school lunch is terrible and it's not cool to take lunch to school, apparently. So they get home and they just binge eat crap, junk food.
Yeah.
And then they'll have dinner whenever mom gets home. That's what their diet is like. 80% of the patients I work with. That's
not good
that's
for
not
growing body or anybody.
Yeah. I'm like, you're growing. You need protein. Those are the building blocks of who you are. You need protein. You need your vitamins, your minerals from your foods. You need the healthy fats.
Yeah.
You know, our hormones, our neurotransmitters depend on healthy fats and proteins. So how are you going to have the energy to learn? You're not. The other thing is they're not sleeping. They're staying up on their technology all night and not sleeping, and it's interrupting the development of their brain. Their brains are still developing, so they're not getting that quality sleep. So they're moody, they're irritable. You want to talk about behavioral issues in kids, because of that, is the technology, not eating well, and it's not just eating well, but all the chemicals that are in these foods, all the food dyes, and you know all those other things on there that just really compromise their everything, their nervous system, their immune system. Everything is just affected by that. So this is why this is the introduction to cancer for them. If they don't change it, they will have a higher risk of cancer. To me, cancer is like the ultimate, like hell no, you know.
Right.
Like I'm gonna do whatever I can on my part to prevent it for myself and to help my patients prevent it. Because I do work with cancer patients and I see how much work it takes for me and my patient and the families to reverse this financially, how much they're having to invest, right? And it's a worthy investment. But it's a lot. And also mentally, the stress of when is this going to go away? And I'm sure they're thinking, is it going to go away? You know? And just forever always having to screen. You know, I have patients that reverse the cancer, they're cancer free, but every 6 months, every year, we're still doing the checkups.
And then there's still that fear, oh, I hope it didn't come back, or I hope it's gone.
It robs you of your peace. So for me, I say, hey, you pay the price now, or you pay the price later.
Right.
Pay the price now by eating right, exercising, making sure you're sleeping, managing your stress. And there's many ways to manage stress. Whether it's taking herbal supplements, whether it's exercising is a great way to, that's how I alleviate my stress. You know, go kickboxing, go lift some weights, go hiking. And then I feel like, whoa, the weight of the world just lifted off of me. That's what I want people to understand. That's what exercise can do for you. It's a huge stress relief, and it'll help you sleep better.
When I was in med school, I worked out 6 days a week.
I admire that about you.
Competed in bodybuilding, and students that we went to school with would say, how do you have time to work out? And I was like, I don't have time not to work out. This is what gets me, I have mental clarity, I have energy. Everybody was so adrenal fatigued and just exhausted, and their eyes, and trying to survive on coffee or whatever, and that wasn't me. And I say that exercise is what got me through 32 credit hours a term, and clinicals and internships, and all these clinical exams we had to take every year that were tremendous. So exercise can really help us get through life.
Absolutely. And that was one thing that I admired about you and a couple of other people that I noticed in our cohort, that they were consistent about exercise. You know, I went in with a mindset of medical school, being realistic about the level of stress, the time commitment that we had to do. And going into medical school, I told myself, I refuse to come out sick.
Right.
When I finish medical school, I will be healthier than when I started. And I did. I accomplished that, by taking care of myself early on. And so, but to be able to compete while you're in medical school, that is an achievement in itself, because, I don't think people understand how involved, you know, medical school is. I mean, I couldn't make it to my grandmother's funeral. I had to fly out of the country, and it was during finals week.
I had the same
couldn't
experience.
do it.
Yeah.
Yeah.
Mm-hmm.
So it's a sacrifice, you know, and it was something that I had to like dig deep down and pray about that. And in my spirit, I almost felt like my grandmother's spirit saying, "It's okay, I'm already gone. I'm not there."
Yeah.
And that would be something my grandmother would say, like, just do what you have
Supporting
to do.
your role.
Yeah,
Yeah.
supporting me, and just like, don't stress about it. I'm not there anymore in that body.
Right.
But you got to push through this. So I felt peace of that. But there were weddings and things, events that I couldn't make it.
Right.
Because this was a priority. You know, the idea, if I don't do these things, I will fail, is a hard reality that we all have to face day in and day out. And so I think one of the things that you and I have in common is that we don't give up.
No.
We don't like to fail. We're not going to fail. Not if we have control of
Right.
that outcome. We're going to do our part, give it 100%, and push through.
Yeah. So, in terms of patients wanting to know about how much services cost or feeling that the services are too expensive, also indicating, well, my insurance doesn't cover it, what kind of comments or response do you have to patients when they bring these things up?
So I always start with explaining how I work different than conventional doctors, and I explain the different paradigms. So a conventional medical doctor, they need to see 20, 30 plus people a day, and they work under the insurance companies.
Mm-hmm.
And so I bring back to their experience of, you know, well, you're seeing a doctor for a couple minutes, and that doesn't really give you much time to interact for them to understand and give you the proper recommendations. The other thing is that they're heavily relying on insurance companies to cover that expense. And so there's a lot of rules that patients don't understand how insurance works. There's a lot of rules and guidelines that doctors need to follow in order to be compliant under the insurance system.
Mm-hmm.
If they don't, then they can lose a contract with that insurance company. And so insurance in a way dictates to doctors how they operate.
Mm-hmm.
I always tell them, you know, that who pays the doctor is who makes the call.
Mm-hmm.
You know, so if a doctor's, if I'm taking insurance, then the insurance is my boss, because I have to listen to them. I have to listen to the rules, follow the rules, in order for them to cover my patient's, you know, bill.
Mm-hmm.
If I don't, I'm out. They won't want to work with me. Now, when you look at the naturopathic doctor, the patient's paying me directly,
Mm-hmm.
so I work for my patient. We cut the middleman out.
Mm-hmm.
I don't have to run under the rules and guidelines of an insurance company, which they're not doctors to begin with.
Right.
So they should not dictate to the doctor how they wish to, you know, treat their patient.
Mm-hmm.
The treatment plan is between the doctor and the patient. It's
Mm-hmm.
between us two. So you're getting a whole different experience, a whole different quality of care. And yes, you may have to pay for the services, but the outcomes are where the benefit is at. So you might have to pay for that visit or the therapies your insurance not covering. But long term, you are saving yourself money and time. You really are, because you're gonna get better through your illness. Your energy's gonna improve. Your mental clarity is gonna improve. You're gonna be able to work better, be more efficient in your job, which will help you produce more income potentially. You know, and that's what I usually see in my patients is they get better, and so they have better opportunities because now they're healthier. So you may have to make an investment. I always try to change the words that they use to explain that the experience they're going to have is better. The relationship is completely different.
Yeah.
And because of that, they're going to see results.
Mm-hmm.
They're going to see results, and it's going to save you time and hassle. You know, I've had people with lupus. You know, that's a very debilitating condition.
Absolutely.
And the insurance will cover your rheumatologist and all the specialists and all of that. You might have some out of pocket in that. That's what insurance is doing now, though. But people are having out of pocket expenses regardless of insurance.
Yeah.
So you're still making an investment after you've paid your premiums. You have maybe some out-of-pocket costs with these doctors. And, 9 out of 10 people are not feeling better through that experience. But when someone comes and sees me, they're making the initial investment up front, and we're getting them to where they need, to where they're feeling better. They're not having to come as often, maybe every 3 months or 6 months.
Yeah.
Right?
Right.
And so they can live a quality of life. So we can't just get fixated on, well, that's expensive. Because I'm going to tell you, people find a way to pay for things that are not bringing them value.
Yeah, like what are they paying for that, they're not thinking about a $5,
Exactly.
$7 coffee a day?
Right? Little things. It could be little things like
Yeah.
$7 a coffee. The average meal, $15 to $20 if you eat out on a, not even a high-end restaurant, just something kind of fast food.
Yeah, that would be high-end.
Yeah, not at all. But they're an average if you're eating out $15-$20 that you're spending to eat out. Like all of these things add up. But here's the other thing too, is that I have people who are spending money on expensive shoes and purses and clothing. They're traveling, they're financing some of these things. They think that paying for your health care, it's someone else's responsibility.
Yeah, right.
Instead of seeing it as I'm investing in my wellness, in my health, so that I can be better, more optimal, so I can live a better life, a quality life, right?
Mm-hmm.
So I always make sure I explain that there is a difference, that you might have to invest money. And I don't force anyone to do anything. If you think my services are too expensive, go back to your insurance model. There's a reason why you're looking for a doctor, and when a doctor's good and they value their time, they're also going to want to work with patients who are dedicated, and they're going to do their part. So if you're looking for a $50 doctor, keep looking.
Yeah.
Keep looking,
Mm-hmm.
because my time is valuable, and I know my areas of expertise. I know how this works. I know what to look for. We're not going to waste time.
No,
We're not guessing here.
Mm-hmm.
We're doing, I always say, I'm a medical investigator. I'm investigating what's going on with you.
Mm-hmm.
Physically, mentally, emotionally, spiritually. You're getting a lot of value for meeting with a naturopathic doctor. You don't get that value with insurance. Insurance won't cover us because of the amount of time we spend with a person. If I worked with insurance, I actually looked at this early on in my practice.
Mm-hmm.
And when I met with this person would help practices set up insurance, he said, I don't recommend as a naturopathic doctor that you work with insurance, because you have to work with the top 5 insurance companies, and you'd have to pay someone who's going to do all the billing, who's going to chase the money,
right,
to make it work for you. And he said, and you would have to see significantly a lot more patients. Where if I'm spending, 90 minutes on a new patient, an hour on follow-ups, 30 minutes maybe on follow-ups, or an hour on a therapy, I can't see 30 people in a day.
No,
There's
right.
no way.
Uh-huh.
And so then I would have to change my whole model of how I work with people. I'm not willing to compromise the quality of service, the time, the energy that I invest in a patient who is willing to pay me.
Right.
I'm not willing to compromise that
Right.
for someone who wants to be cheap and wants their insurance to cover it.
Mm-hmm.
You can't have it both. You can't have it both ways. I'm sorry. I personally stepped out of the conventional medical system as a patient, and I was willing to pay someone who knew what they were doing,
Mm-hmm.
and they got me where I needed to be. And it was the best investment ever.
So tell us about your experience.
Yeah, I was 27 years old, and I had been hustling and bustling all my life, burning the candle on both ends, going to college full-time, working full-time. I was an overachiever, and I did great in my job. I was a top performer in my industry. But things changed over time. I started to feel tired and slowing down, and cognitive function started to decline, and eventually it took a lot of years for me to make it into a doctor. So I finally got into a doctor. I was 27 years old. I'm getting diagnosed with hypothyroidism. I didn't even know what a thyroid gland was, because medicine was not my background, business
Right.
was.
Right.
So I was an educated person, but I didn't know what a thyroid was. And this is 2006. thyroid was not talked about the way it is now. Oh, I remember
Yeah.
doing the research. There was nothing on the internet then.
Mm-hmm.
Now there's books and there's podcasts and there's people who just specialize on thyroid health
Because it's so common.
because it's so common.
Yeah.
But I remember asking the doctor, what causes this? And she says, we don't know. But here's a medication. You got to take it for the rest of your life. And so she tells me you have diabetes, your liver function is not working. Her initial approach to me was, Anna, are you able to take time off from work and from school? Because I was finishing up my bachelor's at the time.
Uh-huh.
And I said, well, I'm sure I could, but why would I do that? And she said, because you really should be admitted to the hospital right now. With the liver enzymes the way they were and other markers that were so off, she was concerned for me and she thought I should go to the hospital and get the blood sugars and everything under control. And I said, well, I'm not going to do that. Why don't you tell me what I need to do? Because I'm not going to stop working. I'm not going to take time off. I was like a month away from finishing my bachelor, so I wasn't going to do that. And so she took all her scripts and gave me all these medications, and I'm like, well, what is this for? And how long do I take this? And she said, for the rest of your life. So I started negotiating with her. I'm like, I'm not taking that drug. I know this one's not good, and I'm not that one. What are the other options? I asked about diet. No, there was no change I had to make at all. Just take these medications and you're fine. That's what I was told.
Mm-hmm.
After every follow-up visit, I asked, well, can I speak to a nutritionist? Maybe there's something I need to eat different. They did set me up with a nutritionist. It was a joke. Now what I know, and when I look back at what I was told to do, it was a complete joke of how they were telling someone with diabetes how to eat. I thought that I would
Compared
never,
to what we know.
yeah, now from what I know, I would never tell a person with diabetes to eat those things at all. Those would be the first things to go.
What was it, like the food pyramid?
The food pyramid, yeah.
Standard.
You still do your grains and your breads and all of that They were still integrating all of those things where, for my patients, I keep it pretty basic. I'm like, if you eat protein and your veggies with minimal fruit, like low glycemic fruit, you're going to do fine.
Uh-huh.
And we just need to make sure you're eating at the right times. Because I wasn't eating breakfast. I was my typical patient. I was eating later in the day and nothing earlier. And so I stayed in that model. My labs, everything was fine over, a 3-month period, but I felt worse. I felt worse because I had now all the side effects from the medications. And, I started to take some things into my own hands and make changes. But it was about almost 7 years until I started to feel better through just my own trial and error. And then when I did get significantly better, I still felt like there's something that's off. 95% of the time I felt great, but I was avoiding gluten. I was avoiding, the sugar. I was avoiding MSGs. I didn't have any processed food. But every once in a while I would feel, not well.
Mm-hmm.
And so that's when I stepped out of the conventional medical system. My insurance covered everything, but they didn't do anything for me.
Because they like keeping you functionally ill.
Yeah.
You become a long-term customer that way.
Absolutely.
Yeah.
Absolutely. You're like a processing plant. You just go through the line.
Mm-hmm.
And I noticed that early on. Because when I started to make the changes on my own, and the diabetes reversed, and I lost tons of weight, and I was feeling better, when I went back to my doctor, she's like, oh, the medicine's working. I said, no, it's not the medicine. And she's like, well, what did you do? I said, I changed my diet and I started exercising. And I remember she cocked her head like, no, really, what did you do? Like, she didn't believe me. And I just laughed. I said, I don't know, what is it about you doctors that you don't see the value of what we eat makes a difference in our body.
Uh-huh.
And so at that point, I was like, I'm done with you. I'm done with this system. And I kept searching. Once again, the seeking part. I was seeking for something different. And I found a doctor. He was actually a chiropractor, but he was doing functional medicine.
Okay.
And I went to see him, and he told me, he congratulated me. That's what
For figuring things out on your own.
He was so impressed.
Yeah.
And I was so shocked at his reaction. We spent like 2 hours together.
Wow.
I have never, I didn't even know what that was going to be like. I was so happy. And I remember I cried out of joy to see a doctor acknowledge me, to hear me, to respect me, and then to congratulate me and say, wow, you did this all on your own? Like, you're 90% there of what I would have you change.
That's
So
terrific,
the changes you need to make are very little. And I was like, I saw hope.
Mhm.
I had hope now that we're gonna get to the bottom of this. So he did. He took me through. He had me do labs, a lot more labs than any of the other doctors that I had insurance, because
Yeah.
insurance wasn't gonna do it for us.
No.
He did all these tests, and that's when he said, "Oh, you don't have a thyroid issue. You have an autoimmune issue." I had Hashimoto's. Well, the
Oh.
approach to Hashimoto's is very different than just someone not making enough thyroid hormone. My problem wasn't that my thyroid wasn't making the hormone. It was my immune system was attacking my thyroid
Right.
gland. A whole different, scenario what's going on,
Right.
and the approach is very different. So I worked with him, and in a very short time, 3 months, 6 months, I felt better every month. Like, I was 100%. And if it wasn't for me investing the money for the appointment, the labs, the supplements, the treatments he put me on, I would never have thought about going to medical school. There's
Yeah.
no way.
Interesting.
No
Yeah.
way. Because what my two main concerns that I had was fatigue and memory concentration, which
Uh-huh.
are the things that you need to get through medical school.
Right, or anything in life,
anything.
right? I don't know anybody that can function
Yeah, you
without.
need the energy. You
energy
need to
and-
you mentally be there to
Mhm.
learn, to memorize, to concentrate on things. And if it wasn't for that investment, because that's what it was an investment in my health and my
Right.
wellness,
Mhm.
that turned things around. And when I felt better, that's when the idea was like, how many people are out there struggling with chronic disease, and they're so sick and miserable, and they might not be as determined as me. They might not be seeking. They might believe everything their doctor is telling them and think this is it. There's no solution.
They don't know they have a choice.
They don't
Yeah.
know that's the thing is,
Yeah.
a lot of people don't know their options. They don't know what choices there are out there. They don't know not the alternative, but the options that they have
Right.
to get themselves better. And so through that, I thought, I want to go back. I want to be a doctor, but I don't want to be a medical doctor.
Right.
I knew that from the get-go. We're not going to play that in that playground.
No.
We're not playing in that playground. I need to do something
Herding
different.
cattle.
I looked at this doctor who helped me, and I'm like, I want to do what he's doing, but I don't want to go become a chiropractor and then learn all those other things. So I thought maybe I have to go to medical school and then learn all these natural ways. So then it was actually a chiropractor friend of mine who said, there's a naturopathic medical school here. Why don't you look into it? And I did that same week.
Uh-huh.
Next week I was visiting the school, and I'm like, this is it. This is what I want to do.
Mhm.
My decision was made very quick. And that's the other thing. When you are healthy,
Yeah.
physically and mentally, emotionally, you will make decisions that quick
Yeah.
because you're clear. It's like this glass of water. It's clear.
Yeah.
If I throw mud and dirt in there, it's going to be muddy. It's not clear.
Mm-hmm.
But when you have clarity in your physical body, in your mind, it's either good or not. And my decision was made that quick.
Uh-huh.
This was like November of like 2012, and I immediately signed up for classes to start. I had to get all my prerequisites since I didn't have a background in medicine, right?
Mm-hmm. Right.
So January of 2013, I started doing all my prerequisites, and I made it happen to where I can get waived out of all these other ones that I didn't need
Yeah.
to just go right into the organic chemistry, biochemistry, and got all of that done in 1 year.
Wow.
There's no
Yeah.
way. There's no way I would have done that 2 years before.
Right, because you couldn't think.
I
you
couldn't
focus.
think. I was super depressed. Didn't even know I was depressed. Fatigued. I could sleep all day and I still felt tired.
Mhm.
I was forgetting things left and right. Sometimes I would roll through a stop sign thinking, did I stop? Or did I just roll through? Like, that's a safety issue.
That's dangerous.
It was dangerous, and I was terrified. I would feel bad because I'm not an irresponsible person. But here I was behaving in such a way, not because I intentionally was, but because my brain just wasn't connected, right?
Mm-hmm.
And so, this is my life for many years. But then, like I said, and then in 2014, I started medical school right away. But that's what I tell people. That was my journey of getting out of, what I call the mafia of insurance and that system.
Yeah.
And going to seeing someone who, first of all, cared about me. They listened to me. They respected me. and they were willing to guide me through that process. They knew what they were doing. This was his jam.
Yeah.
He knew this in and out, what he had to test. And he told me, insurance is not going to want to cover this. That's okay. I will pay cash for it.
Yep.
I was desperate. I will pay to figure out if this is the problem. And that was, everything was there that we needed to fix. That's what we do for our patients.
Yeah.
We're trying to break them out of prison, not keep them in prison.
Right.
So why would you want to continue to use insurance?
Hey, I'm in prison. I've got 3 hots and a cot, but is that really the way you want to spend your life? Right? I mean, It's the same thing. I mean, we're making choices for our health. When we make choices for our health and our well-being, we have quality of life, not just existence.
That was exactly it.
Yeah.
I felt like I was just dragging my body in this life. I always used to tell my colleagues, I feel like my soul is dragging my body in this life. Like I'm not really here.
Mm-hmm.
I felt like I was half alive and half dead. That's misery.
That's like one foot in the grave. That's not.
And I was 27.
How many people are living that way?
Yeah, a lot of people.
A lot of people.
And that was my wake up call. And I know that was meant to be my process and journey, because that's what makes me the doctor that I am today.
Right.
I listen with compassion. I'm seeking to understand my patient and how to better guide them without judgment,
Mm-hmm.
but being compassionate and saying, okay, these things in your life, we need to change, and we need to start little. Everyone's different. That's the other thing too.
Some people jump right in.
We don't do cookie cutter treatments.
No.
As naturopaths, we do individualize as much as we can to each patient,
Mm-hmm.
and help them we meet them where they're at and guide them from there.
Mm-hmm.
Yeah. So that's my approach to insurance. Is if you want insurance, then keep going through the model that you're going through.
Yeah.
Yeah. Because otherwise, we have to play by their rules, and then we can't practice how we were trained to practice using the therapeutics that we were trained to use. We can't operate under that model. I'm sorry. That's not something I decided. That's just the way it is. It's just the way it is.
And what's a common theme of a patient that comes to you? Or is it somebody who's sick and tired of having been in the system, or is it somebody who already knows that naturopathic medicine is for them? What do you see the most?
I see more people that are sick and tired of going through that process line and not getting anywhere. The last 3 years has created a huge shift in mindset of people, where there's some that are not necessarily sick and ill, but they're like, hey, I know I'm going to have to see a doctor, but I want to have the right doctor on my side.
Mm-hmm.
I want a doctor who knows that if I'm ill, like what do we do to prevent illness? But if I'm ill, that I can feel safe going to this doctor, and they're going to properly help me and guide me through that. But there is a lot of people who are just sick and tired of going through the standard, medical system and not getting anywhere. They're not getting results. If anything, they're getting worse.
Yeah.
Once again, you have one foot in the grave.
And then they tell them, well, you're just getting old.
Yeah.
That is never.
And you're 30 years old.
That's never anything I ever tell a patient, no matter
No.
what their age is. It's not age, it's that there is a solution to every problem, right?
Absolutely. I have a patient. She's amazing. She's like 96 years old, and you would think she's 50. She looks healthy. Her skin is great. Her hair is great. Her health is great. And she only comes to me for her annual, exams to see where she's at. And I've asked her so many questions in that time, especially initially, like, what do you think contributed to your health, you being so healthy and being 96? This woman walks and she hikes. She's active. She's always been active. But here's what she said to me. She said, honey, she says, I've always slept really good. I have never cheated myself on sleep. That's the one constant. The other thing, she's always ate whole foods. She eats real food. So those two things, just, sleeping well and eating well. What a concept. So you don't have to go invest money and see a doctor. You can start with those things. Now, if you don't have the discipline to change your diet and eat well and manage the other foundational things right in health, then that's when you seek for someone who can help you get there.
Yeah.
And, unfortunately, people who have debilitating chronic disease, they're so fatigued. They don't know where to start.
Yeah.
They need guidance. They need someone to shine light and guide them through that. And then once they get there, they take off.
They have no hope, and the doctor they're working with isn't giving them hope.
Yeah.
Yeah. Usually just the opposite. Yeah. So.
It's scary.
Mhm.
I always am cautious about speaking negative about, doctors and people in healthcare.
Yeah.
Because I know that the intention for them was always to help people.
Yes, absolutely.
So I feel like the system that they're working in, though, it doesn't work. And a lot of doctors are working for a corporation.
Yes.
And I've noticed that even in the area that I'm in, a lot of the doctors who used to have their own clinical practices, they have sold it to a larger entity to take over. So when you do that, you lose a lot of how you want to practice.
Yeah.
Yeah. That's the one thing I like about being, having my own clinic.
Right.
Is I call the shots, how my business is going to operate. And I do not allow anything to influence or interfere with the integrity of the relationship with my patients at all.
Yeah. And that's the best feeling.
It is.
The
I
best
have
feeling.
control of that.
Yeah.
And because I don't work with insurance, I don't have to worry about someone dictating to me. I will share this with you though. In the last couple years, what I have noticed is for my patients who have insurance, because we can still do labs with the insurance companies, and they can still pay for their prescription medications. As long as it's not Medicare or Access, right?
Right.
Medicare Access, it won't cover any naturopath anywhere. But if it's private insurance, labs and medications can get covered. Not the natural therapeutics, but the medications.
Yeah.
Those individuals, if I prescribe, say, metformin to someone who, that's the route we're going to take for blood sugar control, I put them on metformin. The pharmacy has started to send me a notice saying, hey, we noticed, and this is the insurance telling the pharmacist to let me know that this person that I put on metformin should also be on a statin drug to protect their kidneys. Well, why?
Yeah.
I'm the doctor.
Right.
I did the labs. I see their kidney function is great.
Right. And we're going to continue to
There's
monitor
no
that.
cholesterol.
Right. Yeah.
Why am I going to put them on a statin drug? Because there's other things that we're doing. We're doing the diet. We're doing herbal stuff. We're doing other things to help them with managing the diabetes, right? So why is the insurance company interfering with that relationship, telling the pharmacist to let me know, hey, I need to prescribe a statin drug to my patient? No, that's not doctors need to stand up to that and say, no.
Yeah. Oh, absolutely.
You don't tell me how to treat my patient. That's between me and my patient.
I can't tell you how many times I've done that.
It's gone out of
just
control
put my
these
foot
last
down.
couple years.
Yeah.
And that's just one example of how insurance interferes and starts to dictate. So, it's more of an expense for them to cover. Why? And these are the kinds of things I tell my patients. The other thing, too, is patients will bring in their labs, their statement from their insurance company. Right? When they get their labs done, that I recommend, let's do these labs. They'll bring in the statement, and it'll be the fees of all the labs, and then what they owe to the insurance company. There's one particular scenario that I remember. It was like $3,100 for the labs, and the out-of-pocket cost to the out-of-pocket cost of the patient was like $380 of that $3,100.
Interesting.
And so I told the patient, man, this is really sad. These exact same labs I can run with a cash pay company for $200, $250,
Yep.
which is less than what you're paying out of pocket to them.
Yes.
This is why we don't work with insurance.
This is why.
This is why.
Because we have a better
And so,
option.
we have better options. This is going to save you money. So the patients are like, well, can we just use that lab next time? Absolutely. Because when we use this other lab, you will know exactly the price that you're paying for those labs.
Absolutely. Yep.
There won't be any surprises. If it says $253.82, that's what you're going to pay them.
And there's
it's
no surprises.
done. No
right.
surprises.
Yep.
And so that's the other reason why we don't like working with insurance, because there's always that, hey, by the way, you still owe this amount. Or they're not wanting to cover certain things. You do a lot of regenerative medicine. So I'm sure you're doing like MRIs and scans, right? Sometimes for joints. Insurance says, well, we first have to start with an x-ray. Well, maybe that x-ray for what you're looking for, it's irrelevant.
It is.
X-ray is not most of the time, right?
Yeah. We know that the patient doesn't have a fracture, it's a soft tissue injury. So why are we spending the money on an x-ray before we do an MRI?
Exactly.
And then sometimes they don't even approve the MRI. Recently I had a patient who, she has a shoulder issue, sent her for an MRI, and the insurance company wanted me to send her clinical notes. I got her approval, or her consent to send them. So I just sent them what they needed. And then they had the gall to tell the patient, well, we're going to approve it, but we don't see why you need it. Well, guess what? She has a tear. That's something I can fix.
Yeah.
That's something I can fix. I'm the doctor.
Yeah.
So that's something I'm commonly up against.
Exactly.
With insurance companies. Now, everything else being equal, I mean, I could tell the patient, here's your order for an MRI. It'll cost you $300 if you want to pay cash, or we can fight with the insurance company to get it covered. And I ultimately don't know what the patient had to pay for that. Maybe it was $50 or I don't know, but there might have been some expense to her, but was it really worth it?
Yeah.
You know?
Most of the time what I see is when it's run through insurance, even if they cover it, there's the out of pocket, it's still higher than if they would have paid cash.
Yeah. Yeah.
It's ridiculous.
It's ridiculous. Like they'll still pay $400 or $500 for the MRI.
Yeah.
Because the insurance is, charged $1,500, right? And so, yeah, that's
these companies. They bump up their prices significantly when they're running it through insurance versus the person's paying cash.
right.
Here's a pet peeve of mine that I do get from, not my patients obviously, but I hear from other people when they're inquiring about a naturopathic doctor, or and these are, I'm mindful that these are people who are not very respectful and not the most intelligent, people sometimes, and that is when they make a comment of, you're just in it for the money. And I laugh.
I
right?
say, how much orthopedic surgeons get paid for what they do?
Yeah.
They're probably up in the $500,000.
Let me tell you guys, naturopathic doctors do not just go in it for the money.
Oh no.
The majority of naturopathic doctors that go into this kind of medicine is because we have a personal history, a personal story. We have a big reason, a calling to do this kind of medicine, right?
Absolutely.
So it's not, what we invest into our education, it's hundreds and thousands of dollars.
Literally. I have
right?
a $500,000 school
Yeah.
loan. Yeah.
Most people end up
$500,000.
$200,000 to $300,000 in student loan debt after getting through medical, just the medical school part of it.
Right.
So are we in there for the money? No, we're not. We understand what we're up against, and there's a lot of hard work to do. So, but that person won't ask, if they buy a pair of Nikes that cost them $150, they don't ask Nike, or they don't tell Nike, you're just in it for the money. Because guess what? They are just in it for the money.
Yeah.
We need to wear shoes, but that's not like a life-changing experience
Try to
for
get
you.
a pair of cheap shoes for $5. I mean, I'm not recommending that,
Right.
but it's like, what's your intention for buying these shoes?
Right.
Status. I want to, impress people. Well, if you really want to impress people, get your health in order. Because
Absolutely.
when you're in shape and you've got cognitive function and you are performing at a high level and you're manifesting success in your life, that's how you impress people. Not by going out and spending $200, even $1,000 on a purse. That's not
right. Those companies are just in it for the money. And
Absolutely.
here's the other thing is, we need companies to run labs and imaging, but those companies are charging the insurance that much more money because they are in it for the money.
right.
So we are charging for our value and our time, our expertise. Here's the other thing about naturopathic doctors is that I don't cheapen myself and say I'm a primary care, or I'm not. I offer primary care services to my patients, but we're specialists in what we do. We have a level of expertise in what we do in our realm, and a much more well-rounded knowledge on the human body, on the mental, emotional aspects of healing. We have an understanding of integrating all of that.
Yeah.
So it's not fair to even make the comparison to seeing a conventional doctor. They're good at diagnosing and the pharmacology of it. But if you want to get results and you want to reverse disease, you need to see a naturopathic doctor.
Yeah, because they're not into.
They're not in it to reverse.
They have no intention on getting you better. Their whole goal is to manage your symptoms over your lifetime, and you will get worse, and you will need another pharmaceutical for this symptom, which will cause other symptoms you'll need another drug for. It's not uncommon that I've seen patients come to me and be on 15 different medications.
Oh yeah.
And I've been able to get them off everything. I have one patient, he came to me, he was on a few medications, including 3 blood pressure medications. He was overweight, stressed, tired, he just, the works, didn't have a good diet. He was very compliant with treatment. And as we moved through the healing process, we were down to off all of his medications, down to 1 low dose antihypertensive. That was it. And he was like, I am happy with that. He didn't have the side effects he was having from all the, polypharmacy, and he was just feeling so much better. People don't need all these pills.
Yeah.
The reason they're on these pills is because they're never told that they have another option, that there are solutions to the problem. There are solutions to every problem.
Absolutely.
And nobody but a naturopathic medical doctor will tell you that
when
it comes to your health.